Hello, in this video we are going to talk about cervical cancer. So if you don't know who Latinas Contra Cancer is, Latinas Contra Cancer is a nonprofit organization founded in 2003 in San Jose, California, that aims to help Latino families facing cancer. Before we get into talking specifically about cervical cancer, I want to begin by clarifying that not all tumors will lead to cancer. Cancer generally manifests as a tumor, but some tumors are benign. These can often be removed, and in most cases, they do not come back. However, malignant cancers or malignant tumors will cause problems in our body. This is because malignant tumors will have cells that will travel to other parts of our bodies. In benign tumors, the cancer cells stay within the same area. In malignant tumors, however, the cells are so monstrous and unrecognizable that they just cause chaos and travel through our other parts of our body, through our blood and our lymph nodes, causing cells there to become cancerous. Once the cancer travels to multiple parts of our body, it is a lot harder to remove. And I want to talk about why it is important for Latino communities to learn about cancer. It is important because 1 in 5 Latinos in the United States die of cancer. Cancer causes more deaths in the Latinx community than heart disease, which is the leading cause of death in white communities. Breast cancer specifically is the leading cause of death in Latinos, and cervical cancer is diagnosed more often in Latinos than in other ethnicities. Latinos in general are also diagnosed with cancer at much more advanced stages compared to other ethnic groups when it is more difficult to cure. This is all because Latino communities are much more likely to be exposed to all the factors that promote cancer, such as unhealthy air, unhealthy diets, etc. And this is because Latino communities in this country are more likely to have low income and to live in areas that have poor air quality, to not be able to afford healthy food, to not be able to pay for health insurance, or to have access to the education that teaches them the risk factors for cancer and how to prevent it. That is why it is important for us as Latinos to understand that these are the disadvantages that our community has in this country so that we can take control of our health and take the preventive measures that we can. So now we are going to talk specifically about cervical cancer. This is the female reproductive system. We have the uterus and the fallopian tubes. Cervical cancer is cancer of the cervix, which is circled here, and it is basically the door to the uterus. The cervix is everything from here to here. Looking at the cervix through the vagina, the way the doctor would see it, it would be as if we were looking at the uterus this way, starting from here, looking into here. And it would look like this, kind of like a pink donut. Beyond this little hole is the uterus. Beyond the hole is the actual uterus. This little hole is what needs to dilate to 10 centimeters for a baby to come out of the uterus, and it usually looks like this. It usually has a very small opening and is smooth and pink. The main cause of cervical cancer is the human papillomavirus. If you want to learn more specifically about HPV, we have a whole workshop dedicated to HPV prevention targeted to parents, since prevention against HPV is most effective when it starts at a young age. HPV is a sexually transmitted virus. Since it is sexually transmitted, the virus has direct access to the cells of our cervix, which is why it mainly causes cervical cancer, but it can also cause other cancers. Through the same way, like I said, it can cause anal cancer, cancer of the male reproductive system, and cancers of the mouth and throat. The way that this virus causes cancer is that it deposits its DNA into our cells, which can interrupt the instructions of our own cells. When the instructions for appropriate cell division are interrupted, cells can then grow and divide uncontrollably, which is what cancer is. If you are interested in the biology of cancer, we will be having a workshop on the biology of cancer on our website as well. You might also wonder how prevention of HPV is most effective at young ages when it is a sexually transmitted virus. So please take a look at our HPV prevention workshop, which addresses many misconceptions about the HPV vaccine for children. In this presentation, we are going to focus on the cancer that HPV causes, not on HPV itself. So please look at the resource, especially if you have children that are not vaccinated against HPV. So you might often hear about the risk factors for a disease, like risk factors for breast cancer, risk factors for diabetes. These are some of the risk factors for cervical cancer. Risk factors are things that happen often in people who are diagnosed with that disease. Often people who engage in a risk factor become exposed to the things that actually cause the disease. For example, having a previously sexually transmitted disease is a risk for cervical cancer, as you can see here. This makes sense because people with previous STDs are inherently sexually active, so they are more likely to end up actually being exposed to HPV, which is the thing that actually causes cancer. So it's not the fact that the actual infection of another STD causes cancer, it's just that it's common for people who end up with cervical cancer to also have these factors. So some other risk factors for cervical cancer are having a sexual history, having a weak immune system, since that means if you do get an HPV infection, your body will have a more difficult time fighting off the virus. Smoking, long-term use of birth control pills, a diet low in fruits and vegetables, a family history of cervical cancer, and having an IUD are all risk factors for cervical cancer. Actually, having an IUD reduces your risk of cervical cancer. Again, people who do or have these things are probably just more likely to also end up being exposed to HPV, which is the actual known cause of cervical cancer. So what does cervical cancer look like? Again, this is what a normal cervix looks like from the doctor's point of view when they look into the vagina. There are various stages of precancer. Unlike other cancers, it is very easy to catch precancerous stages of cervical cancer. Precancer stages are when the cells of the tissue are growing abnormally and look abnormal, but they are not fully malignant and unrecognizable and cancerous yet. It is easy to catch these cells in these two precancer stages in the cervix because the cervix is so easily accessible by a doctor. If it's like the pancreas, we can't really look at your pancreas unless we like open you up in a surgery, but a cervix can be very easily looked at by a doctor. So these precancer stages can be found. The abnormal cells often just look like white patches. These white patches can be removed by a doctor to prevent them from developing into cancer, which is why early detection is so important. Symptoms for cervical cancer do not show up until the advanced stages, but some of those symptoms are abnormal vaginal bleeding, pain around the pelvis area, swollen legs, abnormal vaginal discharge, problems urinating, and having urine with blood. The first stage of cervical cancer is defined as when the cancer has not left the cervix. The cervix is marked here by this darker pink color, and these are the cancerous cells. This is a really small patch of cancer cells in the cervix. This patch of cells can still be cut out by a doctor very easily to stop the cancer from growing. It can keep growing to become a tumor. Here, the tumor is still in just the area of the cervix, so it is still stage 1. It is more difficult to remove now, though, since it's covering a lot more tissue and space. Stage 2 is when the tumor has started growing past the cervix, but still stays within the vagina or uterus area, still not too far from the cervix. Stage 3 is when the tumor has grown all the way into the vagina or uterus and even to the pelvic wall outside the uterus. Stage 4 is when there is metastasis and it has spread to multiple areas of the body, such as lymph nodes, the bladder, the rectum, etc. At this point, to remove all the cancer cells, there are multiple areas of the body that need to be targeted, so it becomes a lot more difficult to remove. Because of that, the survival of cervical cancer decreases quite rapidly the further the cancer spreads. When the cancer is localized, which means when it's just at the cervix, the survival of cervical cancer is almost 100%. It's 92%. When the cancer is regional, that is past the cervix, but still within the pelvic area, the survival is 56%. But once the cancer is distant and has metastasized and spread to other parts of the body, the survival rate is only 17%. This is why early detection on cervical cancer and HPV and prevention of HPV is so essential to save lives. And remember, we said that Latinos are often diagnosed in late stages of cervical cancer, and Latinos are also more likely to die from cervical cancer than other ethnicities precisely because of that late detection. So the primary way to detect abnormal or cancerous cells in the cervix is through a pap smear. This is a screening test for cervical cancer. This is what the procedure of the pap smear looks like. The doctor will give you a gown or a sheet to cover up and will ask that you remove your pants and underwear. You will lay down on a table with your legs open. The doctor will insert this metal tool, which is called a speculum, so that they are able to see your cervix easily. This is your cervix right here. The pap test itself is these next two steps, when the doctor uses a wooden stick to rub your cervix to try to grab some fluids and cells from the surface of the cervix. Then they will use a brush and insert it in the small hole of your cervix to try to get some cells from there as well. And that's it. The cells that were collected will be sent to a lab and examined to see if there is anything abnormal or any sign of an HPV infection. The American Cancer Society recommends getting a pap smear starting at the age of 25, and then one every 3 years after 25 years old until you are 65 years old. This is whether you have been vaccinated against HPV or not, but especially if you have not been. There are two possible results that you can get from a pap smear test. If you get a negative result, that means the cells that were collected from your cervix look normal. So you can just come back in 3 years and for your next recommended pap smear, and you should just continue to protect yourself against HPV. If you have a positive pap smear result, that means that the cells collected from your cervix looked abnormal to the doctor that examined them. Those cells could be precancerous cells, meaning they are not too abnormal yet, or they could be cancerous cells. Your doctor will likely recommend further steps to determine how abnormal the cells are, and then determine if they will remove them or determine the stage of cancer. Again, precancerous cells are really easy to remove. A doctor usually just freezes those cells and cuts them off with a small metal clamp. It can be a little painful, but it successfully removes those cells. If the cancer is found when the cells have grown a lot, that procedure is often not able to be done and more aggressive measures have to be taken. We will be having a workshop about what to expect after a positive pap smear on our website as well, so please check that out if you want information on that, if you have a family or member or friend that's battling through a positive pap smear diagnosis right now. Hopefully, though, we were able to convey the message that getting your recommended pap smear is extremely important to prevent the development of cervical cancer and to prevent a diagnosis at a late stage. If you need help finding insurance, a doctor, or making an appointment to get the HPV vaccine or your routine pap smear, please feel free to contact Latinas Contra Cancer. On the screen is the number of our patient navigator, our current patient navigator, who is in charge of all of that. Her name is Maria, and the number is 650-701-7671. To get an HPV vaccine for your children, you can just ask any family medicine, internal medicine, or pediatrics doctor or pharmacist. To get a pap smear, you can go to any family medicine, internal medicine, or OB/GYN doctor. If you know it is time for you to get a pap smear and the doctor hasn't suggested it, please advocate for yourself, your health, and your life. You have every right to tell your doctor that you want a pap smear and they should be able to give it to you. You can also get a pap smear while you're pregnant if it's necessary. A pap smear does not hurt a pregnant woman or the unborn baby. I also mentioned that one of the treatments for abnormal cervical cells is to cut out a small piece of the cervical tissue. This treatment does not lead to infertility and it's very safe. In addition to pap smears, there is also an HPV test to detect if you have an HPV infection. The recommendation for these is to do one every 5 years between the ages of 25 and 65, but these are often done by the doctor at the same time as your pap smear since they are performed in the same way. A pap smear is a detection measure. It prevents the detection of cervical cancer at late stages. However, the main form of prevention for cervical cancer so that you don't even develop those abnormal cells is the HPV vaccine. Since cervical cancer is caused by HPV. The HPV vaccine can begin to be administered at 9 years of age until 26 years of age. It is 2 doses, but after 14 years old, you need 3 doses for it to be as effective. Again, we have a whole workshop about HPV prevention targeted towards parents. So if you aren't sure if you should vaccinate your child against HPV, please watch that presentation. The only other way to prevent HPV and thus cervical cancer is to practice safe sex so that you prevent acquiring an HPV infection. Other methods to prevent cancer in general is to stop smoking, to eat a healthy diet, to exercise, and to reduce stress. We have resources on healthy eating and activities for the community for mindfulness and stress reduction, so let us know if you're interested in any of that. Again, Latinos who have a cervix are more likely to be diagnosed with cervical cancer than those in other ethnicities. They are also more frequently diagnosed in late stages of cervical cancer and are more likely to die from cervical cancer than those in the white population. This is why we urge our community to educate themselves and their friends and family on the barriers we have and on the recommendations for cancer prevention so that we can stop this disparity. We also want to bring attention to the importance of support groups for people with cancer, cancer survivors, or family members of people who've battled cancer. Support groups improve the quality of life of cancer patients, survivors, and family members because they provide mutual support and understanding. Support groups can reduce isolation and loneliness, reduce emotional trauma, and increase hope and self-esteem. Latinas Contra Cancer has a Spanish-speaking support group, so please call our office if you're interested. Finally, please remember that cervical cancer is treatable and curable if detected early. Cervical cancer or any cancer is not a punishment from God or anyone else. And talking about cancer and educating ourselves, our family, and our friends can save lives. Thank you so much for watching this presentation on cervical cancer. You can follow our organization on Facebook or on Instagram to know about any future events, education events that we will have. All of our education events always have a gift card raffled, so you can get a chance to win $20. So go ahead and follow us on Instagram and Facebook to know when those events are. And other than that, thank you very much for watching.